It has been recommended that you have a study to monitor the way you breathe while you sleep. The Embletta recording device allows you to undergo a sleep study in the comfort of your own home. This diagnostic study will reveal whether you have a sleep disorder. The most common types of sleep disorders are obstructive sleep apnea and snoring. This video will show you how to hook yourself up to the Embletta in your home. We recommend that you read the Embletta hookup card and familiarize yourself with the Embletta and sensors before you prepare for your sleep study. The Embletta may have already been pre-programmed to start and stop recording at the appropriate time or times. Allow yourself at least half an hour before the start time of your study in order to attach all the sensors and get ready for bed. The Embletta recorder, sensors, and straps may already have been set up for you by your Embletta provider. Please follow only the steps that apply. Now that you're at home, you will need to unpack the device and sensors to ensure you have the following items in your carry case: the Embletta recording device, the Embletta strap, the sensor proxy with sensors attached, the Embletta hookup card, 2 respiratory effort belts, thorax and abdomen, a nasal cannula, an oximeter with finger wrap, and medical tape. Your Embletta provider may have also provided a nasal thermistor and snore sensor. Based on the type of study being done, your clinician may have decided that you do not need all of the sensors for your study. If you are in doubt, please contact your Embletta provider. Your clinician may have given you 1 or 2 respiratory effort belts. These belts are intended to be worn over your night clothes, not directly on skin surface. Locate the yellow labeled Abdomen Exact Trace Respiratory Effort Belt. Place this belt strap with the label connection facing away from your body around your abdomen. Center it just above your waistline and connect the belt around your body as shown. Plug the yellow tip into the yellow sensor input on the sensor proxy. You may need to readjust the straps by tightening or loosening the Velcro tabs in order to keep them secure when you lie down to go to sleep. The belt should be secure, but not uncomfortably tight. Next, locate the blue-labeled Thorax Exact Trace Effort Belt. Place the belt around your chest, above your breast area, and fasten in the same manner as the abdomen belt. The blue tip sensor plugs into the blue sensor input on the proxy. If your clinician has supplied you with a snore sensor, the side with the small raised bump should be placed directly on your skin. Locate your Adam's apple and position the snore sensor to one side of it. Use the medical tape to secure the sensor in place. The snore sensor is plugged into the white sensor input on the proxy. Place the prongs in your nostrils. Loop the tubing around your ears, then position the tubing under your chin and tighten the prongs into position by pushing the bolo slide or toggle towards your chin. The nasal cannula is plugged into the lure lock on the Embletta unit. Twist clockwise to tighten. You may have been given an oral thermistor. Position the nasal prongs so that they follow the contour of your nose and place the prongs in your nostrils. Loop the wire of the oral thermistor around your ears, position it under your chin and tighten, just as you did with the nasal cannula. You may need to bend the sensor so that it is in line with your mouth in order to detect your breathing, but it should not touch your lips. Next, you can secure the nasal cannula or thermistor by fastening the tubing to your cheeks with the medical tape and pressing firmly. The oral thermistor can then be plugged into the gray sensor input on the proxy. To monitor your oxygen level accurately, you must remove any polish from your fingernail before securing the sensor. Place the oximeter on your index finger. The preferred application side of the oximeter is the index finger. Grasp the blue tab on the oximeter finger wrap. Peel the paper backing away. Firmly press the sensor against the adhesive side of the finger wrap. Wrap the short flaps around your finger. Carefully fold the oximeter tape over the tip of your finger so that the light emitter and light detector are vertically aligned. Now wrap the long flap around your finger to secure the sensor in place. Next, secure the sensor wire with a piece of medical tape. Your clinician may have supplied you with another kind of oximeter sensor, which is similar to a peg or clip, in which case you can simply insert your finger into the sensor. The oximeter sensor plugs into the brown sensor input of the proxy. Your Embletta provider may have already connected some of the sensors to the Embletta proxy for you. If one of the sensors has disconnected, simply reconnect using the color-coded inputs. Before going to bed, you will want to check a few things in order to ensure a successful sleep study. Please check that the sensors are placed correctly on your body. Check that the sensors are firmly connected to the proxy. Plug the sensor proxy into the Embletta device with the colored spots facing towards the front. You will hear a beep and the device will power up. Be careful not to put pressure on the sensor wires or connectors. When you are ready to go to bed, wrap the Embletta strap around your abdomen where it will be most comfortable while you sleep. Adjust the strap so that it is snug and secure. Check that the proxy is firmly connected to the Embletta. Turn off your cellular phone, as this may interfere with the recording. Check for a red light on the oximeter attached to your finger. Finally, check the indicator lights of the Embletta device. A double flashing yellow light means your recording is prepared for the appropriate time and is pending. When the Embletta is recording during the programmed time, or when the start button is pushed successfully, a double flashing green light will appear. A red flashing light or battery light means immediate attention is required, and you will need to contact your Embletta provider. Start the recording. If you have been instructed to start the Embletta sleep study, press and hold the Start button until the green light turns on. You may use a blunt object, such as the tip of a writing pen if needed. If you have been advised to stop the recording upon waking, press and hold the Start button until the green light turns off. Upon waking, please disconnect the Embletta recorder and return it to your Embletta provider. Your sleep study will be downloaded and analyzed. Your doctor or clinician will then discuss the results and treatment options with you. Thank you, and sleep well.